Good evening, doctor. Good evening, my friend. We are from small group discussion B2, and at this opportunity, we're going to present our student project, and the title is Carbapenem resistant Enterobacteriaceae. First of all, we will introduce our group member. Next slide. The member name and the student number can be seen on the slide. Okay, let's start our presentation from the first chapter, introduction. The background will be presented by my friend.
Okay, next slide, please. Okay, hello everyone. My name is Putu Ari Nirajanari, and the last 3 digits of my student number are 049. And I'm here to explain about the background of why we are choosing this topic for our student project. So basically, humans need normal flora in some areas of their body, for example, such as Enterobacteriaceae in the human gastrointestinal tract. However, there is a phenomenon where the normal flora enters the bloodstream, then change into a pathogen that can cause a disease. There are various infections that can be caused by Enterobacteriaceae group of bacteria, and one of the therapies that can be applied to overcome it is by giving antibiotic to the patient, such as carbapenem antibiotic. Carbapenem is said to be the last choice of antibiotic used for therapy in treating various infections. This is because previously there were several gram-negative bacteria that were observed to have resistant properties to most antibiotics. It's certainly a concern for the medical world globally that this phenomenon can become a threat around the world due to the increase in the number of patients as well as an increase in the cost of therapy. Therefore, further deepening of the resistance is needed, especially carbapenem-resistant antibacterial. That's all from me. The next slide will be presented by my friend. Thank you.
Okay, thank you. My name is Putu Ari Apsari with the last digit number of my student number is 058. I will continue this presentation by explain. This is our problem formulation and also objectives. Next. And also this is the benefits from our paper. Next, please. Okay, the next is definition about Enterobacteriaceae. Enterobacteriaceae is mostly found as part of the normal flora in the human or animal colonies, also a part of a large family of gram-negative bacteria. Enterobacteriaceae, like all bacteria, can develop resistance to antibiotics, including the carbapenem group of antibiotics. These pathogens can spread to the bloodstream, resulting in life-threatening complications and can cause healthcare-associated infection or HIAs. That's all from me. Thank you. Next.
Okay, so my name is Vyasa. My last 3-digit name is 051. So for the type of Enterobacteriaceae, there are currently over 170 species and about 50 genera in the taxonomy family. And there is about 26 genera that have contributed to human infections. For the classification, they're divided into 2 types, depending on whether they ferment lactose or not. The first one is lactose fermenters, Citrobacter. Citrobacter can be found in a number of environmental sources, and both the human and animal gastrointestinal tracts. And the second one is Escherichia. They're broadly divided into 2 groups: those that stimulate cell proliferation and those that inhibit the cell cycle. So for the third one is Enterobacter. For the ornithine decarboxylase is one of the biochemical traits that can be used to differentiate them with Klebsiella. And the last one is Klebsiella. This organism is live in soil and water. And for the non-lactose fermenters, there are Shigella. This bacteria normally lives in the human gastrointestinal tract. And for Yersinia, for the example is Yersinia enterocolitica, which is common in domesticated animals and aquatic species. And for the third one is Proteus. This bacteria usually is the clinical cause of urinary tract infection. And for the last one is Salmonella. We can prevent the reproduction of this bacteria, but not kill them by using a refrigerator. And that's all from me. Thank you.
Okay, thank you for the opportunities. My name is Utami. Putri. My last 3 digit of my student number is 067. So the definition of carbapenem is one of the antibiotics that is considered to be used because Carbapenem is the most potent group of antibiotics with therapeutic efficacy. This is frequently used as definitive antibiotics, but nowadays some of the pathogens are resistant to the carbapenems. These pathogens are divided by WHO into 3 categories. Those are critical, high, and medium categories. So one of the critical categories included pathogens that are resistant to carbapenems. The example are Enterobacteriaceae species, Pseudomonas aeruginosa, and Acinetobacter baumannii. That's all from me. Thank you.
Okay, introduce myself. My name is Prema Pratnya with the last 2 digits of my student numbers are 064. Now I will continue the presentation with the story of carbapenem. So the first carbapenem reported was tianamicin, which was isolated from Streptomyces cartelia in 1976. But because of tianamicin have instability in the water, so the clinical use of tianamicin is limited. Because of that, several carbapenems have been produced through optimization of medical chemistry, such as imipenem, meropenem, doripenem, ertapenem, diapenem, and tebipenem. Okay, that's all from me. Thank you. And my friend will continue in the next slide.
Okay, I will continue the presentation. So good evening, everyone. My name is Tanya Amaris. With the last 3 digits of my student number is 060. In this opportunity, I will explain the types of carbapenem antibiotic. The first type is imipenem. Imipenem is a carbapenem antibiotic that has a broad spectrum and is more potent than other beta-lactam antibiotics. It is typically used in combination with cilastatin, a drug that inhibits imipenem metabolism by inhibiting dehydropeptidase in the renal pools. The second type is meropenems. Meropenems are carbapenem antibiotics with broad activity against gram-negative, gram-positive, and anaerobe bacteria. Meropenem is also resistant to chromosomal and broad-spectrum beta-lactamase. The third type is ertapenem. Ertapenem is a carbapenem antibiotic that has a narrower spectrum of action than imipenem. It is approved for once daily intravenous administration. And the last type is the most recent carbapenem. The name is doripenem. It is an antibacterial spectrum, resembles that of meropenem and imipenem more than ertapenem. As a result, it exhibits insignificant in vitro activity against Streptococcus and methicillin susceptible staphylococcus. That's all from me. The next slide will be presented by my friend. Thank you.
Okay, I will continue. My name is Putu Ari Apsari with the last 3 digits of my student numbers are 059. And now I will explain about the side effect of carbapenem. So generally, carbapenem can give side effects start from nausea, vomiting, diarrhea, and at high doses or exceeding normal limits can result seizures. However, for each type of carbapenem causes a variety of side effects. First, meropenem can cause abdominal pain, thrombocytopenia, eosinophilia, neutropenia, headache, paresthesia, and local reactions. Second, imipenem can cause diarrhea to colitis, allergic reactions, myoclonus, confusion, confuse, impaired mental function, reddish color in the urine, redness, induration, and thrombophlebitis. Third, ertapenem can cause 3 different types of side effects. There are general side effects include headache, diarrhea, nausea, vomiting, and rest. Not common side effects such as dizziness, somnolence, insomnia, dyspepsia, erythema, pruritus, asthenia, edema, and malaise, and unknown frequency side effects such as anaphylaxis, dyskinesias, hallucination, tremors, and Rett syndrome. And fourth, doripenem can cause headache, pruritus, increase in liver enzymes, rashes, and phlebitis. That's all from me. Next, please.
Okay, so everyone, I'm here again to explain about the mechanism of carbapenem that is included in beta-lactam antibiotic. This group of antibiotic works to kill bacteria by inhibiting the synthesis of cell walls. So at first, carbapenem will binding with penicillin binding protein receptors to bacteria as many as it could. As a result of the bond, there will be inhibition of the transpeptidase reaction, which is indicated in the inhibition of the synthesis of the peptidoglycan layer. Then there will be an inactivation process of enzyme inhibitor autolytic enzyme on the cell walls of the bacteria. So that activation of autolytic enzyme will occur, which can cause lysis in bacterial and lead to the death of bacteria. That's all from me. The next slide will be presented by my friend. Thank you.
Hello, my name is Utami Kanya Utami, and my last digit number is 048, and I will explain briefly about the role of carbapenemase enzyme. Carbapenem is a subclass of antibiotics that used to treat gram-negative bacterial. Practically, the most important carbapenemase are metalloctamase and or class B carbapenemase. This group of enzymes use an active site including one or more zinc ions to catalyze the hydrolysis of lactams by stimulate the production of nucleophilic hydroxide, which then attacks the lactam ring. Carbapenemase can hydrolyze carbapenems effectively. These include chromosomal enzymes, which are pervasive among several uncommon diseases and the majority of environmental isolates. Because of the ongoing evolution of carbapenemase and the widespread distribution of mobile genes encoding carbapenem resistance, infection have greater rates of morbidity and mortality. Combining carbapenemase inhibitors with antibacterial backbone compounds, such as carbapenems, offer therapeutic option and extend the lifespan of current antibiotics. That's all for me, and the next slide will be presented by my friend.
Thank you. My name is Gede Pramaditya Wahyu Saputra, and the last three digits of my student numbers are 045. In this occasion, I would like to present the effect of Enterobacteriaceae as a carbapenem resistance in human body. Carbapenem-resistant Enterobacteriaceae is one of the major bacteria in the World Health Organization list of antibiotic resistance as a priority pathogens that get the biggest threat to human health. Similar to any antibacteria that is resistant to particular antibiotics, Enterobacteriaceae has its own strategy to let the antibiotic, who in this case is carbapenem, to be degraded. Carbapenem have R groups on the adjacent thiazolidine ring that can shield their beta-lactam ring from degraded by beta-lactamase. Unfortunately, Enterobacteriaceae has its way to circumvent the shield that is leading to the antibiotic degradation by efflux pump, where it can physically pump those antibiotic molecules back out of the cell again. This case is leading to a bigger problem where Enterobacteriaceae become the pathogens that cause more complications such as complicated urinary tract infections, complicated intra-abdominal infections. There's also lung infections such as ventilator-associated pneumonia, hospital-acquired pneumonia, community-acquired pneumonia, and bloodstream infections in patients with indwelling catheters. That's all from me. Thank you.
Okay. Hello everyone, my name is Dinaria Sakura Kirani. The last three digits of my student number is 055. And here I am presenting to you treatment options for carbapenem-resistant Enterobacteriaceae infections. The first options is using combinations treatment. The usage of carbapenem and other antimicrobials have been shown that it makes several benefits such as higher successful rate by lower the mortality rate. The example of other antimicrobials that could be combined with carbapenem is polymyxin. The second option is using high-dose tigecycline. Tigecycline has a non-nephrotoxic characteristic, but tigecycline could only use when there is no other options. The third option is using aminoglycoside. Aminoglycoside could use alone or combined as a treatment to carbapenem-resistant Enterobacteriaceae treatment. But it is usually people would use combined aminoglycoside. That's all from me. The next slide will be presented by my friends. Thank you.
Okay, I will continue the presentation. My name is Nilokade Asabintari with the last three digits of my student number is 063. Today, I would like to present about the conclusion and the advice related to the topic of this presentation. Conclusion. Carbapenem antibiotic, last choice antibiotic therapies, could be given to patients with Enterobacteriaceae infections, but it has resistant properties. Therefore, we need to know further about the type of carbapenem antibiotic and the side effect of this antibiotic, so that we could give the right therapy later to the patients. The carbapenem antibiotics mechanism and its resistant mechanism in Enterobacteriaceae must be understood because it could give some effect to humans' body. The development of some groups of antibiotics has been done as treatment option of CRE. Although the treatment options has been found, we must still use the antibiotics wisely to decrease the number of patients who are resistant to carbapenem antibiotics. Next slide. Advice to the government, they need to socialize more deeply about the dangers of Enterobacteriaceae resistant to carbapenem. To the citizens, they need to have more literature on the resistance of Enterobacteriaceae to carbapenem and be able to select information properly. To the researchers, they need to do further research regarding treatment or alternative drugs that can be used to avoid and reduce the impact caused by carbapenem-resistant Enterobacteriaceae. That's all from me. Thank you.
Okay, that's all our presentation about carbapenem-resistant Enterobacteriaceae. Thank you for listening, and we're sorry if there are some mistakes during our presentation. Thank you.